those crazy politics in Afghanistan. Let's talk about people that are actually standing up for what is right. Who is this that we have joining us right now, Edward?
We have on the line a nurse from Ohio named Maddie. Let me see if I have her on the line. Hi, Maddie.
Hi.
Lauren has told me all about you. And I just want to be the first to say to you, I'm very proud to speak to someone who had the courage to stand up to the medical establishment and also care for those who are hurting.
Thank you so much. It's so good to talk with you guys.
Well, Maddie, without revealing the hospital name or keeping some of your identity at least protected, that's the best way, protected, because we definitely know there are people out there trying to get nurses like you fired and taken away from the people that need your help. What can you tell us about your experience, where you work, and what you've seen during this pandemic?
Yeah, so during this pandemic, my experience has been working in the hospital has been the same that it's always been, that hospitals are overrun by a lot of Americans who have chronic illnesses. So on any given day, if we have 40 patients admitted to the hospital, I would say maybe 3 to 5 of those are COVID. The real pandemic we are dealing on hand is the chronic disease epidemic in this country. I mean, so many Americans are struggling with high blood pressure, diabetes, congestive heart failure, and it doesn't seem like we ever really hear about that. All we seem to really hear about is COVID.
Well, we keep hearing about the deaths in the hospitals and the lack of ICU beds. That's the leading headline when you look for COVID news this week. They're claiming there's about 70 to 80,000 beds which are being filled with patients. Now, I wonder. I mean, I'm not going to the hospital every day. I think out of common sense. I mean, you're very brave to still be going in, and it's your job, and we all have to do our jobs and all that. But what is actually happening in the hospital where you are? Is it full? Is it true the ICU beds are overflowing?
No, that is not true. What is actually happening and what they're referring to when they talk about hospital capacity actually has everything to do with staffing. So capacity doesn't mean physical beds. It means how many nurses are willing to show up and take care of patients. And that number is dwindling away because nurses are tired of hospital politics. Nurses are really frustrated with the conditions we're working in. It has nothing to do with COVID, but everything to do with nurses walking away from the bedside.
Well, Maddie, you're saying something interesting there. So let's say you had a hospital with a 500 bed, you have a 500 bed hospital, and it takes a certain number of nurses and medical professionals to fully staff a 500 bed hospital. So what you're basically saying is they're kind of playing with the math a little bit. Because you only have a certain number of nurses, certain number of medical professionals available, say to maintain only 300 of those beds, therefore they're saying that if 300 beds are occupied, therefore they're at capacity. Is that what I'm hearing from you?
Exactly.
Wow.
We have open beds. There are just physically not enough healthcare professionals to take care of the patients in the hospital.
And the reason why there's not enough healthcare professionals is because, first of all, they're tired of all the stupid rules and everything that health professionals are having to line up for. And then there's just people who just said, I'm just fed up with it. I'm just done, and walking away from it. Wow, man, that's stunning. And what that tells me is that we are being played once again with the numbers, aren't we?
Absolutely. And let me be clear, there is no nursing shortage in this country. There are plenty of nurses, but there is not enough nurses willing to work in hospitals right now and deal with what's been going on.
Well, what has been going on? Are there some individuals, we've heard testimonies from people I think we trust that are experiencing COVID-like symptoms, have had to be placed in a hospital, either give steroids or air or just simple care, fluids. Are you seeing some of that? Are there some people that have come in with what appears to be COVID or a variant? Because, again, we do a lot of reading here, and we try to speak to those who can tell us what's happening on the ground. You're on the front lines. What are you seeing?
Absolutely. What I'm seeing is whether you are vaccinated or not, and that's one of the very first few questions we ask patients when they come into the hospital. Are you
ask
vaccinated?
That first?
Unfortunately, it's one of the screening questions, yes. We have to ask patients, so I know who is vaccinated and who is not. And I can tell you across the board, COVID presents the same. COVID attacks people who have underlying health problems and have a lot of inflammation in their body. So the CDC and the government have come out and say, okay, well, the vaccine, it doesn't prevent COVID. It doesn't stop the spread of COVID. It helps you get less sick. But in my experience, that's simply not true, because I see vaccinated people all the time getting just as sick as the unvaccinated.
I've seen those headlines. They keep saying the majority of the people that are in the hospitals are unvaccinated. It's a pandemic of the unvaccinated, right, from our absent president. I mean, so you're saying that's propaganda. That's essentially been a lie.
Yeah, absolutely a lie. Absolutely a lie.
Now, we saw out of Dallas, there was a memo that was leaked from a hospital administrator who's in charge of ethics. And there was a call to triage based on vaccination status. Now, you're saying that it is standard practice, maybe not just in Texas, but all around the country, all the way up even to Ohio, to ask about vaccination first before maybe other pertinent questions. Have you seen triage based on vaccination status?
I have not personally seen triage based on vaccination status, but I have seen a lot of healthcare professionals with a lot of bias. I have heard other nurses say things like, I don't even feel bad for this person. They are unvaccinated. They've given what they deserve. So it's interesting because I see a lot of people talking about, well, I don't want an unvaccinated nurse taking care of me, when really the most biased healthcare professionals are those that are so pro-vax.
Right.
Maddie, the thing I'm continuously confused by those who chose to get vaccinated, shouldn't they feel the most protected? If they believe the propaganda, is that where they're like in a duplicitous mind now, where they believe part of the propaganda, but they don't believe the other part? Maybe just haven't thought about it, but do they realize that, Maddie? Like your coworkers who are vaccinated, I'm assuming you're not vaccinated. Is that true? Are you non-vaccinated? Okay. What have your coworkers said to you? And have you had that back to them to say, well, you shouldn't be afraid of me, right? Because you're Pfizer protected, you're Moderna protected.
Yeah, they're actually the most terrified. I mean, when I go into my COVID patients' rooms, I'm wearing my simple mask that I'm required to wear at work, but that's the only protection I need. I mean, these people are putting on full hazmat suits to go talk to somebody who has a cough. So they're absolutely terrified. And it's just really interesting. Like you said, the vaccine should offer that degree of protection, but it doesn't seem like those who are vaccinated really believe that.
Hey, Maddie, I got a question for you. We're not seeing that many nurse dancing TikTok videos this year as last year. Do you have a nurse TikTok dancing video, or have that kind of
Yeah,
style
what was happening with that?
They're just not as popular now. What happened? They're just not dancing as much anymore. What's going on?
Thank God that trend died, because I couldn't stand it, to be quite honest with you. I am so happy we are done with the dancing healthcare professionals.
Yeah, it was crazy to begin with, but it kind of gave the idea that this was all, just go along with it. We're all just gonna make our way through this and somehow find our way. And but they're not laughing and dancing as much anymore because they just thought everyone would go along with the program, I guess. And so, but I'm glad you don't have a dancing TikTok video. That's good to know. One of the things that we talked about with our previous guests, it was an administrator with the New York City School District, is the topic of religious freedom. There are a lot of strong Christian believers within the healthcare industry. I commend every nurse and doctor out there that follow their call in ministry to the sick and to go into that particular profession. But there are some very strong people who hold very strong views regarding life, and they are religiously opposed to receiving a jab in the arm. Have you seen any kind of, pushback by hospital administration or anyone in resisting those who may have a religious objection to the jab?
Interestingly enough, a lot of hospital systems that I'm aware of that are religiously affiliated are the ones pushing for mandatory vaccination.
That's a good point, yes.
That was something that was so surprising and disappointing because, these institutions are claiming to be religious, but clearly not respecting anybody's religious freedoms.
How about in your particular situation? By the way, I saw your cat pass by back there, and so But in your particular situation, has the administration or anything said anything in response to the possibility of any of their health professionals raising a religious objection to the so-called vaccine?
So as of right now, you are able to submit a religious exemption. Now, my hospital has not released any details about dates or timelines, but my route that I'm choosing to go is going to be a religious exemption. So at this point, I am just praying that it will be accepted because I will not ever take this vaccine. And I love my job as a nurse. I get to do something really special. And I really hope I get to stay in this field. So a religious exemption is the way I'm going to try to pursue.
Well, I happen to believe that anyone that works in healthcare is called of God to do it, because it takes a special person with a compassionate heart and desire to help others to go into the health profession to begin with. So I commend you on that, and I hope you take it as a divine calling from the Lord and treat it as such, that you have a true opportunity to be a witness for Christ in those situations and circumstances. Let me ask you this, Maddie. Are you the only voice that's standing up against what's going on there, or have others also spoken up in your particular situation?
I have definitely talked with a lot of nurses who feel exactly the same as I do, but unfortunately they are too scared to speak up. And it's funny when we talk about it together at work, it's all, hush hush, very quiet. People are scared. There's a lot of people out there who feel the same way I do, but unfortunately our voices are silenced and we are afraid of losing our jobs. But people just got to understand there's power in numbers. They cannot possibly fire all of us. They can barely afford to even fire 1% of us. So I just don't see these hospital systems firing 10, 20, 30% of unvaccinated staff.
Well, certainly not. You're the ones who keep the hospital running. The registered nurses, the others who, other than the doctors are so busy with their rounds, right, that they don't really have a beat on what's going on in the hospital.
Everybody knows it's the nurses that operate the hospital, right? Isn't that right, Maddie?
And that's
the doctors just show up and take credit for everything. It's the nurses that do the work.
And that's why I want to inquire with you, Maddie, that what have you heard about deaths which were considered to be from COVID, but you knew and your coworkers knew it wasn't? Is that going on? Are deaths being classified as a COVID death? I'm talking about going back to the beginning of the pandemic, even to now, but it clearly wasn't from a gunshot or a car accident. Have you seen that?
Absolutely. I have personally seen patients admitted to the hospital and their diagnosis is COVID-19, and when I read their COVID test result, it's negative. So how are we claiming that this is a COVID-19 admission when even the test, which by the way isn't reliable, is saying that the patient is negative for COVID? So yes, that is a very real thing that has been happening since the beginning of this all.
Wait a minute. Are you saying that they are actually doing the test shows up negative, and they are purposely classifying that as a COVID death?
Yes, I have seen it, and the justification is, well, it's probably COVID. The doctors say the clinical picture points to the patient having COVID, but the test is still reading negative, and they're still being admitted with a diagnosis of COVID because that's what makes money. I mean, COVID admissions and COVID deaths make thousands of dollars.
So that's true, because we've read that, we've heard that there's a certain price tag attached to an individual being admitted, being put on a ventilator, being inundated. There's about 13,000 to 39,000 as a Dr. Whistler last year that laid out the specific details. But Maddie, clearly this doesn't make any sense, because if someone's in the hospital, let's say they are there for some form of COVID-related symptoms, shouldn't they have a large amount of COVID in their system? Like, that shouldn't ever pop up negative. And the PCR test is amplified, correct? So they should be the most positive if they've showed up with risk of COVID, right?
Absolutely. But unfortunately, that's not the case.
Well, you probably get to talk to a lot of doctors. I've heard this. I've heard that the doctors, they know best often. They will argue with registered nurses, or argue with many of the nurses because you're not as educated as them. Well, clearly, Maddie, that's not the case. You're a very smart young woman. And in regard to the doctors, are some of them starting to realize, because they're smart too, right? They've gone to college for a long period of time. They've taken some history classes. They've read about tyranny and these other things. Are they starting to realize that what they're seeing Is not what they're being told by the Biden administration, Dr. Fauci and others, and the WHO?
You know, I really do think deep down they see these things and they realize these things, but for whatever reason, they refuse to admit them. And it's funny because I'll just see so many of my coworkers just going above and beyond to confirm the beliefs they have. Like if we have a sick COVID patient, I mean, they will just make the biggest deal. They're like, well, look at this guy, he's so sick and he has COVID. And you can just tell they're grasping at straws to hold on to the beliefs that they think they have. But you can tell, you know, it just deep down, people know the truth about what's going on.
Well, Maddie, I love speaking to nurses, especially believers. We got a nurse that comes in from time to time. She brings us honey, banana bread. She's wonderful. I don't know if she wants me to share her name on air, so I won't, but I love her and I pray for her. She often has stories about
jerky too. She makes great
beef.
beef
Yes,
jerky.
that's right, beef jerky.
That's for me.
She often has stories about miracles, things she sees in the hospital. Doc was hitting on to me that the hospital is a gateway to eternity. Either going to heaven,
You're either,
or to hell.
you're either
Okay.
coming in or you're going out.
You're coming in or going out. What have you seen as a believer working in the medical system?
Yeah, I've definitely seen so many miracles. And the thing about my job is I have quite literally seen people on the worst day of their lives. You know, I've seen parents lose children. I've seen women become widows, but I've also seen a lot of miracles happen. People that shouldn't have recovered walking out of the hospital. So it's really hard to not believe in God working in healthcare because miracles really do happen every day.
Well, Maddie, I know there are many other healthcare professionals who watch this program. They're going to be, one, probably emailing us and saying, hey, we'd like to also share our testimony. We'd love to have more testimonies,
Yes.
not just from nurses, doctors, anyone, any Christians out there with a testimony. But what would you say to your brothers and sisters in the medical profession to encourage them, to give them strength, to let them know from the church in Ohio that you're standing strong in your profession? What would you say to them to give them strength right now?
I have just got to say there is so much power in numbers, and I just really encourage everyone in the situation I'm in to not make a permanent health decision based on a temporary circumstance. If God calls me away from nursing because of this, I'll go where I'm led. But at the end of the day, like I said, I really love my job. I hope to stay here, and I hope to just rally with other healthcare professionals that feel the same way I do, because there's always strength in numbers, and we should not be scared to speak up, because those who are for the vax definitely have their voice. They're the ones dominating right now, so we need to fight back and dominate as well.
Well, Maddie, thank you so much for joining us today here on True News. And I want to encourage our audience to be praying for Maddie and praying for other healthcare workers. Now you have a face to pray about. Such a joyful person that even in the midst of this crazy time that we're in, and in the midst of having to make some difficult choices, standing up for what you believe in, you just exude joy. I have to commend you on that. That you're still exuding joy, and even in the midst of this, and I thank you for that. The light of Christ really is shining from you. I want to commend you. I want to encourage our audience, be praying for Maddie, and pray for other healthcare workers that you know that are having to stand up for their faith in the midst of incredible pressure. There's a lot more pressure on healthcare professionals, Edward, than there are on the rank and file of us out here. And so I want you to know, Maddie, our audience will be praying for you and lifting you up, and praying for other healthcare professionals as well.
Thank you so much for having me. God bless.
God bless you. Thank you so much, Maddie. Wow.